sound coming from? Is it bone rubbing on bone? Is it a meniscus? Is it ligament?
Hi, thank you for joining us. I am Andy. I am a group fitness instructor based in Salt Lake City, Utah. I teach in a studio as well as online, and I also coach fitness and healthy lifestyles online to my clients in the US, Canada, and the UK. I'm here with Brad today. We want to talk to you about a few things. So Brad, tell us a little bit about yourself.
Hey, I'm Brad. I'm a physical therapist, also based in Salt Lake. I'm in West Jordan, and I treat people in an outpatient physical therapy setting. I've been doing this for a couple of years, and it's a lot of fun to get together and collaborate and see how we can help people understand their injuries and get back to exercise, right?
Yes. That's the hardest thing for me, is when my clients cannot attend class because of injuries. It makes me sad because I miss them. So I definitely want to help them get back to class in the best shape.
And for them, they miss out on their daily life, right?
Yes.
They can't go to fitness, so they don't have as much energy. It hurts, so I can't go to the park with my kids. It's just it's a very fun topic.
Yeah, it feeds into everything, because I've noticed, even in my own personal life, when I can't work out, I'm more stressed. I don't handle situations as well. I'm not as patient with my kids. I don't get as much done. I'm not as proactive. And fitness and your health and your mobility, it feeds into everything. So it's definitely something to talk about.
And the cool thing with it too is once you get motivated to exercise, then you see the benefits and it'll help you keep doing it, right?
Yes.
I feel like that's where people like you can bring so much value, because you help people with that motivation. You get them up and going. It's really cool what you do.
Thank you. I appreciate that. So I have a lot of clients, especially recently, I would say it happens probably more during the winter time that I hear these kind of situations come up, more so in their 30s and 40s age range, of the squeaky joints, squeaky hips, squeaky knees, sometimes squeaky ankles. Usually it's knees and hips that I hear it the most. I honestly don't know, but I feel like it's kind of normal, but could it be leading to a bigger issue, or could it be a sign of something?
And I love the way that you phrase that question, because is it normal? Is it leading or a sign of something? And that's what we've got to listen to. Our body's telling us when these problems are coming, right? So it's like, man, my back's always stiff at the end of the day, but hey, it doesn't hurt, so who cares? Who cares is you 3 months from now when you can't move because now you're injured, right?
Yeah.
So you've got these warnings. These squeaky joints can be warnings. So let's talk about when they're a warning or when it's just normal. And that is hard. That is hard to know.
Yes.
And it comes down to a lot of factors. First off, our joints make sounds, right? That's okay. There's different kinds of animals out there. Their knees make sounds on purpose. That's how they scare other animals away, or let them know that they're there, right? And I'm not going to say which one, because I'm worried I'm remembering wrong. But anyway, our joints are going to make sounds, and that's because it's a mechanical thing. So where's the sound coming from? Is it bone rubbing on bone? Is it a meniscus? Is it ligaments getting caught and snapping out of place? A really good general rule is, if it doesn't hurt, if it's sharp, painful, that's bad. If it doesn't hurt, then we're more likely to be okay.
I love that. Yeah, sorry, I just cut you off.
Oh, go ahead.
I got excited. That's something I do discuss with my clients, is listen to your body. Your body is so incredibly smart. It's going to let you know when something's not right. You're going to feel those pains. And there's also that, especially in the fitness world, what is good pain versus bad pain? Because we talk about pushing and going through the motion and pushing towards that finish line. There's a point where you feel that pain and you know it's not a good pain to be feeling. So
Right.
like listening to your body is so smart. Just listen to it and pay attention to it and you're gonna know.
Absolutely. Yeah, and we should do one of these topics sometime about pain, what pain means, pain science. But
Yeah.
it's a tangent that we'll avoid for
Yes.
right now.
Yes. Absolutely.
It's super valuable. So listening to your body is absolutely crucial. Getting to know your body and then understanding like I have a high pain tolerance is people have different varying pain tolerances, but there's no masculinity in that, right? And it's more often with the men, but some of the women are like, I'm tough, like, and listen, like if it hurts, there's a problem, let's do something, not I'm tough and I'll work through it, until it's worse, right?
Yep.
So kind of back on the squeaky joints, let's talk about where some of that mechanical change can come from. If you're too tight is a really big cause for mechanical changes. As we get older, do you notice it's more in your older clients?
Yeah, as they get older, that's when it starts. My younger clients, I never hear that from them. It's very rare. I would say it's mid to late 30s and higher.
Right. Yeah, and so as we get older, the elastin in our body changes, right?
Yeah.
And anybody out there who's studied physical therapy or any kind of anatomy class, physiology class, you already know about this. But as that elastin changes, our tissues aren't as pliable.
Right.
If we don't help them stay pliable by stretching often, by drinking enough water and having the right nutrition, then our tissues are going to tense up around the joint. And our body's fine. We'll go for a walk around the block or a run, depending on how old we are or how active we are. And then it tightens up and starts to get creaky, right? Or first thing in the morning because we slept all night and our tissue just sat there. So you've got to give your tissues the best chance by keeping them mobile. And some of that's exercise, and exercise through full range of motion, right? But then also specifically attacking the problems that come up. So if my IT band gets tight and the side of my knee hurts when I run, that means that you waited too long. You should have done something about that way earlier, right?
I'm trying so hard not to go off on tangents right now.
Me too.
This is one that I could talk about forever. I even personally have had IT band, and that's why I was like, keep my mouth shut. But I've had IT band issues because of the alignment of my body was off. Like my hips were twisted, which led into my IT band, which led to knee pain. Trying not to go off on a tangent, but everything's connected. And
everything is so connected, and it's so mechanical. As a physical therapist, I feel like my job is mostly just being an engineer for the human body instead for a car, right?
I love that.
Or I guess car mechanic, I don't know. But the alignment, the way the muscles pull, when they pull and extra stress is put on them, now they get tight because they're angry.
Yeah.
And then we get plantar fasciitis. Have you heard of costochondritis?
Mm-hmm.
So that's one that one of the people in my Facebook group asked about recently. Costochondritis, where does that come from? Well, it's all mechanical. And so when we understand our body's a mechanical machine, then we can treat it mechanically. There is no magic fix to it. You can't go to your car and mess with its energy or whatever to fix the change the oil. You got to mechanically change the oil or mechanically realign the tires like your hip, right?
Right. Yeah, absolutely. I've noticed. So a lot of my classes are high intensity. I do a lot of high intensity interval training, which means like high energy, go, go, go. You get like 20 to 40 seconds of like push, push, ultimate max out, and then you get about 10 seconds to recover from that. We do a lot of squats, lunges, push-ups, burpees, a lot of stuff that scares people unless they're coming to class often. And I've noticed that sometimes it takes a little longer for some of my clients to be ready for that movement. We have to make sure that our bodies are like properly warmed up before doing those. And I've noticed that the more we spend time focusing on that warm up and that body preparation, the squeaky joints are kind of less. Is that kind of typical that like the more you prepare your muscles, that squeak is less, or is the squeak consistent? We just don't notice it?
Absolutely, it's going to be less because you warmed up the tissue, so it's not going to be as tight, so there's not as much compressive force. But also you'll notice those who come to your HIIT classes every time. I don't know, do you do them twice a week, once a week? How often?
I have different styles. So HIIT is once a week. I also do step fitness once a week and dance fitness once a week.
So if you have a client who comes to all of those 3 classes, are they the ones complaining about squeaky joints?
No. It's
right.
The people that come like once a month, every now and then.
Right.
Maybe twice a week.
And those who come once a month, are they doing their own exercises? Less likely. I'm not saying you can't exercise on your own. That's great.
Oh, absolutely.
But it's just, we're just talking about the mass population here. So if we take the people who have those squeaky joints, they're not keeping their tissues as warmed up and mobile as often.
Right? Yep.
And I just want to talk to the HIIT class. Fantastic concept, fantastic approach. There's a lot of research out that shows decreased cardiac issues, increased longevity. You're going to have less memory loss with these kind of high intensity activities 1 to 3 times a week. And they actually showed that a half hour of exercise 3 times a week of any kind of exercise movement decreases your cardiac, cardiorespiratory issues. But actually doing a high intensity interval for 5 to 10 minutes is similar in benefit for those things as a whole half hour normal exercise.
Yeah, you get a lot of benefits packed into a smaller amount of time.
Yeah.
That's pretty cool.
There's a place and time for everything, right? We don't want to just do hits and that's
Absolutely.
it.
Variety.
Just like with your program, you're doing it once a week. You know, if that's what someone does 3, 4, 5 times a week and they do nothing else, they're missing out on some other benefits.
Absolutely. Yes.
Well, I think that wraps it up, right? If there's any other questions on this, I don't know. I feel like we've covered it pretty good. If you've got your specific injury that you're like, well, I squeak and what you said doesn't apply to me, let's talk about it, right?
Yeah, absolutely. Like we said, like everyone's bodies are different. So you never know, maybe your scenario or your question or your squeaky joints is different than what we've talked about. So definitely reach out to us. You can reach me by email, which is andybfitness@outlook.com. That's ANDEEB_fitness@outlook.com. Instagram and Facebook, my handle is AndyBFitness.
And you guys can reach me by joining my Facebook group. It's Dr. Brad Physical Therapy, or by watching more of our videos on Dr. Brad Physical Therapy on YouTube. And if the name of that channel changes at some point, then I'll be posting that on the Facebook page. And then you can also find more of the videos that I do weekly at my company's Facebook page. It's Rocky Mountain Therapy Services in West Jordan.
Perfect.
All right, thanks for coming, guys, and we'll see you guys on the next one.